Now yield to Ms. Radewagen for 5 minutes.
I want to thank the Chairman and Ranking Member for holding this hearing today. Thank you, Mr. Chairman. And I want to thank the panel for coming here to share their testimony. I also want to say hello to you, Ms. Bryant. Her colleagues with the IAVA have been to my office several times now and have helped provide my staff with information on a variety of veterans' issues and legislation. I'm glad you could be here to share the IAVA's perspective on today's hearing. Ms. Bryant, based on your testimony, IAVA's Rapid Response Referral Program does try to address these aspects of caring for female veterans. Would you please share with us more about the RRRP and how VA might be able to replicate aspects of the program to improve the VCL?
Yes, Congresswoman. First, I'd like to point out the director of our RIP program behind me, Vadim, who is sitting directly behind. One of the things that we speak about of RIP, they specialize, again, in high-tech, high-touch, which means not only is there the warm handoff to VCL when there is a veteran actively in crisis, actively suicidal, but then we follow up, and that's really the model we would like to see the VCL replicate, is the follow-up care, to ensure that, okay, you've made an appointment for a veteran in crisis, but did they go? Was that effective? We continue follow-up not once, but a few times. It just depends on, again, individual case-by-case basis. And that's the strength of the RIP program, is that it allows for that individualized case management depending on what the needs of that veteran are. And it's not limited in scope to what the VA can provide. It also is for any other program that's available to veterans where RIP can be an advocate for that veteran and allow for everything ranging from whether it's legal services to mental health care, et cetera. Vis-a-vis our women veterans, as we know intrinsically as women veterans, that we don't always receive a welcoming greeting when we go to the VA, and by and large when we call the VCL. Unfortunately, I do not have the data on that, so I can't speak definitively to that aspect, but I can speak as a woman veteran of the experience sometimes being cold or dismissive when women are in crisis, and that's the difference between what the RIP program does versus what we're hearing in negative feedback for the VCL. I do want to also caveat there is positive feedback, and we, again, do not want to see the VCL fail. We cannot continue to have the statistic of 20 veterans a day committing suicide. Thank you.
Mr. Young, Ms. Bryant's testimony notes that we do not know how many women veterans use VCL, nor how effective VCL is at providing support for women. Do you have gender-specific caller and outcome data that you can share with us today? Does VCL track the gender of all callers? To what extent are VCL staff trained to take into account a caller's gender? And does VCL have a specific protocol for female callers? If so, please describe it.
Thank you, Congresswoman. The first thing that I'd like to just add on to the comment Ms. Bryant just made, and to share that for every intervention that occurs, every time that we dispatch somebody to intervene in a crisis situation and deliver them to care, we follow up and ensure that they did indeed get to a medical center and receive the care that they were dispatched to do. As it relates to women veterans and the Veterans Crisis Line, we do honor any request from a caller, a woman veteran, to speak to a woman responder. If we receive such a request, we will honor it. Similarly, any conversations that go into sexual trauma, we will ask the caller if they would like to speak to a person of a specific gender, and we will honor that whenever that occurs.
Thank you, Mr. Chairman. I yield back.